State of cannabis.
This is the State of Cannabis News Digest, a roundup of this week's key developments in the cannabis industry.
From ballot fights to new rules on what can be sold and where, cannabis policy is shifting in a lot of directions at once. In Arizona and Massachusetts, officials are weighing new limits, from cracking down on smoke and odor complaints to pausing new grow licenses as prices slide. In Florida, the next fight is over ballot access itself, with a court dispute that could decide whether legalization even reaches voters. Medical programs are evolving too. Hawaii is moving to cut patient wait times. South Dakota is heading toward digital ID cards, and Maryland is debating job protections for first responders, while keeping strict rules on impairment. And as cannabis drinks and hemp-derived THC spread beyond dispensaries, New York and Missouri are drawing new lines around what can be sold and where. Plus, Pennsylvania ramps up pressure to legalize, while Nebraska faces a rare federal snag as its voter-approved program gets built. Keep listening. We'll bring you the full stories and what each move could mean next.
And now here is the deeper look at the key events in the cannabis world this week.
Florida's latest attempt to legalize marijuana for adults is running into a familiar obstacle: the ballot process itself. Smart and Safe Florida, the campaign behind a proposed constitutional amendment, is asking the Florida Supreme Court to review a dispute over petition signatures. At issue are about 70,646 signatures that state officials invalidated. Reporting says 41,894 were signed by voters listed as inactive, and 28,752 were collected by petition gatherers who were not Florida residents or who were non-U.S. citizens. Secretary of State Cord Byrd directed county election supervisors to toss those signatures. And on January 23, 2026, the First District Court of Appeal ruled Byrd's approach was lawful, reversing a lower court ruling that had favored the campaign on the inactive voter question. On February 16th, the appeal process moved to the Florida Supreme Court, which can decide whether to take the case. All of this sits under one big question: can the campaign reach Florida's ballot threshold of 880,062 valid signatures? The state says it came up short. The campaign disputes the numbers and points to contested invalidations. Another report adds uncertainty, suggesting the state's online tally may not match county totals in dozens of counties. For voters, the next steps may come down to court decisions and counting practices as much as the policy debate. For cannabis businesses and advocates, it's another reminder that in Florida, legalization campaigns can succeed or fail long before Election Day.
In Pennsylvania, a new push is coming from City Hall. On Tuesday, Pittsburgh City Council adopted a will of council resolution urging Pennsylvania lawmakers and Governor Josh Shapiro to legalize adult-use marijuana during the 2026 legislative session. The resolution, sponsored by Councilmember Barb Warwick, argues Pennsylvania continues to treat cannabis possession as a criminal offense in many circumstances, leading to arrests, prosecutions, and incarceration that the council says disproportionately affect communities of color and low-income residents. The council also points to the regional map. New York, New Jersey, Ohio, and Maryland have legalized recreational cannabis. The resolution says that creates an uneven landscape where Pennsylvanians cross state lines to buy legal cannabis, and where consumer spending, tax dollars, and jobs flow out of the Commonwealth. Shapiro has again included legalization in his 2026-27 budget proposal. He said a 20% cannabis tax could generate about $536 million in the first year, including one-time licensing fees. But even after the Pennsylvania House passed a legalization bill last year that would have used state-run stores, the Republican-controlled Senate has not advanced a legalization plan. So Pittsburgh's move doesn't change state law on its own, but it signals that local officials want action, and they're trying to keep the pressure on as budget season and legislative negotiations move forward.
Nebraska voters approved medical cannabis in 2024, but the state is now facing an unusual federal complication. For more than a decade, Congress has routinely included language in federal spending bills that blocks the U.S. Department of Justice from using its budget to interfere with state medical marijuana programs. It's not nationwide legalization, but it has acted like a guardrail for states that allow medical cannabis. The protection only applies if a state is named, and in the spending bill signed into law on January 23, 2026, Nebraska was left off. Advocates with Nebraskans for Medical Marijuana and national groups like Americans for Safe Access say that's rare. The rider is reported to cover 47 states, and the only other states not included, Kansas and Idaho, do not have medical programs. Nebraska's program is also still in early stages. The Medical Cannabis Commission has licensed 3 cultivators, with a 4th expected in March, but none has started growing as officials work on seed-to-sale tracking. Commissioners have delayed other license types like dispensaries and manufacturers, and legal challenges backed by Attorney General Mike Hilgers are still moving through the courts. Senator Pete Ricketts says he respects the ballot process, but remains concerned about marijuana risks, especially for youth. Congressman Don Bacon says he had not interfered and prefers states to lead on cannabis policy. Meanwhile, advocates are holding listening sessions around the state, arguing that patients should not be left in limbo after a statewide vote.
Hawaii lawmakers are advancing a change that could speed up medical cannabis access for new patients, and it's aimed at a basic problem: waiting. Under a bill known as SB 3315, a person applying for Hawaii's medical cannabis program, or their primary caregiver, could make a limited one-time purchase from a licensed dispensary right after submitting the required certification form. That would be a shift from the current approach described in reporting, where patients generally have to wait for processing and for a physical registry card to arrive by mail before they can buy from a dispensary, a delay that can take weeks. Legislators approved the measure during a joint hearing of the Senate Health and Human Services Committee and the Commerce and Consumer Protections Committee. The bill was amended, including a change that lowered the interim purchase limit to 1 ounce compared with the original version. The bill summary also describes the temporary purchase as capped at 50% of standard dispensing limits, suggesting lawmakers want interim access to cover immediate need without offering full buying privileges before registration is confirmed. Senator Joy San Buenaventura said during the hearing that regulators could track these interim sales using administrative rules, and she referenced her family's experience supporting a terminally ill relative as part of why she backed the bill. If SB 3315 becomes law, the Office of Medical Cannabis Control and Regulation would be responsible for facilitating temporary authorizations. Reporting also describes dispensaries verifying eligibility through the state's electronic registry. Some implementation details still seem unresolved publicly, like whether dispensaries will need system upgrades, but the policy goal is clear: reduce waiting time for patients who've already submitted their paperwork.
South Dakota's medical cannabis cards may soon live on smartphones instead of in wallets, and the change appears to be moving forward without new legislation. On Tuesday, Representative Josephine Garcia of Watertown told the House Health and Human Services Committee that her bill, House Bill 1211, is no longer needed. She asked the committee to table it after the Department of Health said it has already started the process to create a digital registry identification card system for medical cannabis patients. Garcia read from a letter sent to the committee by Health Secretary Melissa Magstad. The letter says the department posted a request for proposals on January 16th and is now looking for vendors. Officials plan to select a vendor this summer, and software work would begin in the fall after that selection. The department's plan is to make digital cards the standard option, while keeping the ability for patients to request a physical plastic card. The reports describe the digital version as something patients can access on their phones. No firm implementation date was offered, and the department did not immediately provide a timeline when asked. South Dakota's medical program was approved by voters in November 2020, and the state health department listed more than 18,000 approved patient cards as of February 1st. Recreational marijuana is still illegal in South Dakota, so these registry cards remain the key to buying medical cannabis legally at dispensaries.
Maryland lawmakers are taking up a bill that sits at the intersection of medical cannabis and public safety work. House Bill 797, sponsored by Delegate Adrian Boafo, would prohibit employers from disciplining, firing, or otherwise discriminating against a fire and rescue public safety employee based solely on lawful medical cannabis use. The bill would also cover cases where someone tests positive for cannabis components or metabolites while holding a valid written certification. A companion measure, Senate Bill 439, is moving through the Senate at the same time. The bill defines covered workers as firefighters, emergency medical technicians, cardiac rescue technicians, and paramedics employed by local governments, the state airport authority, or fire control districts. At the same time, the proposal keeps strict guardrails. Employers would still be allowed to prohibit cannabis use while on duty, and prohibit employees from performing their duties while impaired. The bill also adds a reporting requirement. If a covered employee shows up to work impaired by cannabis, the employer must report that incident to the State Emergency Medical Services Board. Hearings are scheduled in both chambers, and if the bill becomes law, it would take effect October 1, 2026. For first responders who are lawful medical cannabis patients, the measure could change how departments treat drug test results, while keeping the focus on impairment during emergency work.
Massachusetts cannabis regulators are talking about hitting the brakes, at least for a while, on new grow licenses. On Thursday, the Cannabis Control Commission voted to schedule a public hearing on a potential freeze of new cultivation licenses and a temporary moratorium on approving additional canopy capacity. The commission says the goal is to stabilize a market dealing with oversupply and sharply falling prices. CCC data cited in the discussion shows the average price for an eighth fell to $14.20 in November, down from $45 in 2021. Another CCC figure puts the average retail price for an ounce of flower at a record low $113 in December, compared with over $400 in December of 2020. Business impacts are showing up too. Reporting cited closures, including Air Wellness's Milford facility, which shut down in August and resulted in 157 job losses. Another report said 24 licensees have been placed into court-appointed receivership. Commissioners pointed to supply growth, noting the number of licensees has increased from 223 in mid-2023 to 686 in January. The public hearing is expected to cover more than cultivation. Commissioners said they also want testimony on freezing other license types, like product manufacturing, craft cooperatives, and micro-businesses. And this is happening while the CCC is rolling out social consumption regulations and dealing with other public health and safety priorities, including worker safety and enforcement. The meeting also revealed tension inside the commission about transparency, after commissioners argued over whether a legal memo about the policy should remain confidential. No vote was taken on releasing it. For now, the next major step is the public hearing, where regulators will ask the industry and the public whether a temporary pause can help a market that's selling more cannabis while earning less per sale.
In Arizona, a new legislative proposal is reopening debate over the limits of marijuana legalization, specifically what happens when cannabis use affects neighbors. Senator J.D. Mesnard of Chandler has introduced SB 1725, along with a companion measure, SCR 1048, that would classify excessive marijuana smoke and odor as a criminal nuisance. The idea, he says, stems from personal experience. Smoke in his neighborhood has, at times, been strong enough to prevent families from opening windows or using their yards. Arizona voters legalized medical marijuana in 2010 and approved adult-use cannabis in 2020. Public consumption is banned, but private use in homes is permitted. Mesnard's bill would amend nuisance laws to create a presumption that excessive marijuana smoke is harmful to health and interferes with property rights. That could make it easier to bring misdemeanor charges, potentially leading to fines, probation, or jail time. The proposal also allows courts to order property owners to stop the nuisance, with costs potentially becoming liens if they fail to comply. Because legalization was voter-approved, one version of the measure would refer the issue back to voters this November. The debate comes as activists pursue a separate initiative to roll back Arizona's recreational cannabis market. For consumers and patients, the outcome may shape not only what is legal to buy, but how and where it can be used.
Missouri lawmakers are moving toward a major change for hemp-derived THC products that have popped up in all kinds of stores. On February 19, 2026, the Missouri House passed House Bill 2641, the Intoxicating Cannabinoid Control Act, by a 109-34 vote. Republican Representative Dave Hinman of O'Fallon sponsored the bill, and it now heads to the Missouri Senate. The bill would prohibit synthetic cannabinoids and set strict limits on hemp-derived THC products, including a 0.4 milligram combined THC threshold per package or container and a 0.3% total THC dry weight cap. It also treats certain hemp-derived cannabinoid products as marijuana for regulatory purposes, meaning cultivation, manufacturing, testing, transportation, and retail sales would have to happen through Missouri's licensed marijuana system under Article 14. That would likely remove many intoxicating hemp products from shelves outside dispensaries. The House adopted an amendment setting November 12, 2026, as the effective date for banning specified intoxicating hemp products. If Congress delays a federal intoxicating hemp ban, Missouri would still prohibit most products like smokable hemp flower, vapes, gummies, and other edibles beginning November 12th, while hemp beverages would have a delayed effective date tied to the federal delay. The bill also adds privacy rules, including limits on disclosing medical marijuana patient and caregiver information and requirements for dispensaries to honor written requests not to keep identifying records. Next up, the Missouri Senate decides whether to keep, amend, or reject the House version.
New York is weighing a plan that could expand where people can legally buy cannabis-infused drinks, without putting them on the same shelf as alcohol. Companion bills filed this past week, Senate Bill S. 9220 and Assembly Bill A. 10191, would let licensed off-premises liquor and wine stores apply for a new permit to sell low-potency cannabis beverages. The products would be limited to single-use drinks with no more than 5 milligrams of total THC, and they would have to be manufactured by New York State adult-use cannabis licensees. The bills put the state liquor authority in charge of issuing the permit, but they also rely on the Office of Cannabis Management to set inventory tracking requirements. Stores would have to keep cannabis drinks in a separate, clearly marked area away from alcohol and maintain detailed inventory records using a software system determined by the cannabis regulator. Sales would be restricted to adults 21 and older. There's also a new tax structure, a 9% tax when distributors sell or transfer the drinks to permit holders, and a 13% tax collected at retail. Supporters say the money would help pay for oversight, fund cannabis equity and small business programs, support enforcement against illicit cannabis sales, and share revenue with local governments where sales occur. The Senate version has been referred to a committee, and the Assembly version is heading to an Economic Development Committee, so this proposal is still early. But if it moves, New Yorkers could eventually see low-dose THC drinks show up in a new, familiar retail setting, under rules designed to keep cannabis and alcohol from blurring together.
That's the roundup. Florida's ballot fight moving through the courts, Pennsylvania's local pressure campaign, Nebraska's rare federal funding bill omission, and a set of medical program changes, from Hawaii's temporary purchase pathway to South Dakota's digital card push, and Maryland's debate over workplace protections with impairment guardrails. And on the market and retail front, Massachusetts considers a pause on new cultivation. Arizona debates smoke and odor enforcement. Missouri advances a crackdown on intoxicating hemp-derived THC products. And New York explores bringing low-dose cannabis beverages into liquor and wine stores under separate permits, tracking, and taxes. We'll be watching what happens next, especially as hearings, court decisions, and legislative calendars turn these proposals into either policy or headlines that fade. This was the State of Cannabis News Digest, available weekly. You can listen to us on all main podcast platforms. To make sure you don't miss out on the latest updates and in-depth analysis of the cannabis industry, be sure to subscribe to our podcast. By subscribing, you'll get notifications for each new episode, helping you stay informed and ahead in the ever-evolving cannabis market. Join us next Saturday for more insights. Until then, keep thriving and stay green.